28 on there already.
What we'll do, we've done a kind of a text reminder to all the students of the next session starting. So people will trickle in, but whenever you want to go, then go for it.
Oh, did you want us to just sort of start or wait a minute? And
I can see that number trickling up. So maybe let's give it a couple of minutes, and then go.
There wasn't much time, was there, for them to get some drink or anything?
No.
I hope they've all got their Health Reach hand out. Oh.
Yeah, we sent that out, so fingers crossed.
Fingers crossed. So that's a bit of evidence as well, isn't it, for them to put in their portfolios?
Okay, guys, thank you so much for the time earlier, students. We've got a really exciting session now, so don't worry, you won't have to listen to my voice again for another hour, and I'm handing over to some other people. So I know that there will be some kind of people trickling on over the next few minutes. That's absolutely fine. But now I think we'll just kick off, and any questions anyone has, I'm on hand to everyone.
Okay, thank you. Hello, everyone. My name's Val. I'm a Health Reach officer at the University of Reading, and my background is midwifery and nursing. And I'd like to introduce Alison.
My name's Alison Hall, and I'm the Health Reach manager. And our project goes out into schools and talks to young people about careers in health and care.
Fantastic. So the next session is going to be called Key Skills for Nurses, linked to the skill of taking a patient's vital signs. And you'll need your Health Reach handout and a pen, or you may have it on another computer or your phone to look at, or a piece of paper. So throughout the presentation, I'll be asking a few questions. So if you could put your answers in the chat box, and I'll share a patient story with you, and we'll be doing a few little activities ourselves as well. And watch out for the vital signs slides, because some of the definitions that are in your handout, the answers will be there for you. Okay. So what is a key skill for nurses then? I'm sure some of you have been looking at this already, but a key skill is commonly needed for activities, isn't it, in life and education. For instance, being organised, but some nurses also need soft skills, such as being patient and empathetic towards patients and patients' families. So in your handout, there are examples of key skills for nurses. So what I'd like you to do is to tick the 3 that you think are important to you. Tick the 3, and if you want to add any more at the bottom, then please do on your handout. And if you would like to, please share with us on the chat box which 3 you think are important. So I'll give you a couple of seconds to do that one. Okay, so well done. My top 3 would probably be team player, caring, kind, and I'll probably add a sense of humour there. Would anybody else like to share what they think? Or you can keep it to yourself. There's no right or wrong answers there, I might add, but it depends on your personality. Some of you may already have these skills. So you can just type in the chat box if you'd like to. Non-judgmental, kind and patient from Precious. Lovely. Anybody else like to share? We're all very individual, aren't we? Caring, patient and effective communicator. Non-judgmental would be important.
That was my top one.
Oh, that was your one. Yeah. Any others from you, Alison?
I think team player was another one of mine. I hope effective communicator and competent.
Yeah, so we're all very similar here, aren't we? And we're all very individual as well. So thank you for sharing, some of you. Others, that's fine. You can just tick it and add to it as you want to as you go along. But the qualities that we would also need are certain skills. We've already Oh, I'll just get you to, we've already been thinking about the commitment, care, compassion, competence, communication and courage that was in lots of hospitals, as well as the NHS core values. But also what we need to be good as nurses and midwives is to be very good at observing, very good listener, effective communicator. Palpation and touch is important, which has been particularly quite difficult at the moment with all the PPE that the nurses are wearing, but also being part of that big team and understanding what you're doing. So let's think about one of the most important activities a nurse and a nursing associate can be doing is to carry out vital signs or observations. And these skills on the previous slide are vital to taking those accurately. So in your handout, there are some physiological measurements, and I'd like you to tick 6 of those that you think would be really important for a nurse or a nursing associate to do every day. And if you don't mind popping them in the chat box as well, that would be brilliant. So the vital signs that the nurses would be doing are respiratory rate, saturation rate, systolic blood pressure, radial pulse, consciousness level and temperature. So hopefully you've got your handout and you can see that there's something called a news chart with it, or a national early warning score chart. And if you've had a look on that, you probably have seen what the answers would be. So well done. That shows initiative and observation and observational skills. So we do record all the results of these measurements on the news chart, and when we plot them on there, which is what we will be doing a bit later after our patient records, we would be thinking how this patient is. Are they within the normal ranges? Have they got a condition that we need to be aware of? Are they deteriorating or are they improving? So what we're going to do now is look at each individual, all of these 6 individuals, and then we'll think of our patient journey. So respiratory rate is, or number of breaths per minute, is a clinical sign that represents ventilation, which I'm sure a lot of you know already, the movement in and out of the lungs. And a change in the respiratory rate is often the first sign of deterioration as the body attempts to maintain oxygen delivery to the tissues. And we know that failure to recognise changes, especially in your respiratory rate, can result in poor outcomes for the patient. So it's really important that we get this right. So before we watch this quick video, I'd like you to pop your hand on your chest here somewhere and count. If you've got a phone or a watch, that you can just count for 30 seconds to see what your respiratory rate would be. Let me give you 30 seconds now and you can jot that down in your handout. So feel for 30 seconds and then times it by 2, and that means that's your respiratory rate over a minute. Also in your handout, it says on there, my respiratory rate can change when I am, and I'd like you to circle on there which ones would affect your respiratory rate, because as soon as we think about our breathing, it changes because we can think about it and we start to breathe more. Okay, hopefully you've all done that. So I'm going to show you a quick video now about how a nurse would do an effective respiratory rate.
To count the respirations, take the patient's arm as if you're checking a radial pulse. The goal of this is so that they don't know that you're counting the respirations. As you do this, watch the patient's chest for rise and fall, counting each time they take a breath. Measure this for 30 seconds and multiply it by 2, and you have your respirations per minute.
Okay, thank you. So an adult, a normal respiratory rate in an adult would be 12 to 20 per minute. So feel free to pop in how many breaths per minute you were doing in the chat box if you would like to. So the next set of observations or vital signs we'd be thinking about is radial pulse and saturation rate. So we do this to assess your cardiovascular system, don't we? And we know roughly a resting heart rate is between 60 and 100 beats per minute. And the blood that pumps around the body gives the oxygen to all our cells, and our normal saturation rate for a person with no lung disease would be sort of 94 to 99%, as you can see on the slide here. A tachycardia is a not abnormally high pulse rate, and a bradycardia is a low pulse rate. So don't forget to pop that into your handout with the terminology there. So now let's think about feeling our own pulse rate. Some of you may well have done this many times, but what I'd like you to do, in your handout, there is a picture of someone with their hand on their pulse. So I'd like you to put your arm out straight, place your index finger and your middle finger on the wrist, come down a couple of centimeters, and hopefully you will feel your pulse rate there. Count it over 30 seconds, times it by 2, and pop it into the your handout. And you can pop it into the chat box as well if you would like to, just to see how many of you are really chilled while you're watching us today. If you can't feel anything, then either move your fingers around a little bit or press a little slightly firmer. And some of you may feel that you want to check your pulse on your neck. Obviously, don't press too hard there, or pop a hand over your heart. So just see how you've got on there. Would anybody like to share what theirs are? I think mine's quite high at the moment, talking to you. Okay, so we've thought about where else you can feel your pulse. And we know now what a fast heart rate is and a slow heart rate is. Also in your handout is what can change. So if you're nervous, if you're exercising, if you're excited, have a little circle which one you think would be important to change your heart rate. So next slide then is about blood pressure. And we know that this can be measured manually with a stethoscope and a blood pressure machine, or with the electronic machines. And it gives that reading which shows the force that the blood exerts on the artery walls. And there's two readings, the systolic and the diastolic. And for adults, the systolic is the most important part, whereas for maternity patients, the diastolic tends to be more important. So the news concentrates on the systolic measurement, and there is a similar thing for maternity called a MAUS, which is a maternity obstetric warning score as well. And that looks at the diastolic, which is in relation to observing if someone has, for instance, preeclampsia or pregnancy-induced hypertension. So we know that hypertension is higher than normal blood pressure, and we know hypotension is a low blood pressure. So what I might get you to do now is to hop off your chairs or wherever you're sitting, settee or the floor, and jump around a little bit and see if you can feel your pulse rate again. Hopefully now your pulse is going to be bounding and faster, which means you're increasing your blood pressure as well. And if you'd like to share me the differences, that would be brilliant on your chat box. And if you document that in your handout, please.
I won't jump around.
You're not going to jump around. You've been sitting around. Do you think it makes any difference? I think it probably does, if we're all sitting here quietly.
Yeah, we had some speakers in our last session who kept telling us so many good questions. I can think of some names, but let us know in the chat box, how is it going? Does it feel quicker?
Does it feel quicker? Has anybody done first aid before and they know about pulses? Would like to share anything? So we'll go on to the next slide because I'm mindful of time. So the other two assessments that we would do is consciousness and temperature. Oh, hold on. So a high temperature makes us feel quite unwell, doesn't it? And you can, oh, here we go. Thank you very much. Someone said it went up to 132. God, you were jumping around lots. That's brilliant. Thank you. So a high temperature can make us feel quite unwell. We all know that, don't we? And it is difficult to really be an accurate measurement of your temperature without a thermometer, but you can pop your hand on your chest here, can't you, to get an assessment. So we know that a pyrexia is an abnormally high temperature above 38, and hypothermia is that lower temperature, and the normal ranges is very different for everybody. We all run at slightly different temperatures, don't we? But average is about 36.5 to 37. So that some of those definitions you need to pop into your handout. The consciousness assessment, or we used to call it AVPU, but now they've popped a C in for confused. But ACVPU is a way of assessing how your patient is. So are they alert, talking to you? Are they confused? Do they respond to your voice? Do they respond to pain, or are they unconscious? And in your handout, there is a little bit, so we're going to go to the next slide now, but in your handout, see how much you remember, that you need to circle the correct words for ACVPU. So now let's find out what's going to happen to Laura as a case study. So Laura's 15 years old and she starts to feel unwell during her PE lesson. She sits down and she feels a bit dizzy and faint, and you notice that her breathing is rapid and she's a bit shaky. So after a few minutes, you see she's starting to struggle to breathe now. So I'd like you to have a think. What do you think's wrong with Laura, and what do you think you should do? So I'm going to give you, it's in your handout actually as well, if you can't think of what I'm saying. But the first one is not sure what's wrong, so I'd call for help. And the second one is, I need to know more. I'll ask her what's happened and then I'll call for help. So can you pop in the chat box 1 or 2 and have a let us know what you would think to do for Laura. So would you, yeah, not sure what's wrong, call for help, or you need to know more, I'll ask what's happened and then call for help. So some of you are saying 1. Some of you are saying 2. Okay. So some of you would like to know a little bit more. Thank you for your answers. Okay, so lots of you have answered that one. Thank you very much. So let's go to the next slide, please. So Laura tells you she's asthmatic and her inhaler's in the locker. So she's starting to wheeze and cannot talk. And her friend calls the teacher and collects her inhaler. So which one would you give her, do you think? Now, some of you may be asthmatic. Some of you may know people that are asthmatic. So what I would like you to do from your handout, there are 1, 2, and 3. So would you give her the brown inhaler? Would you give her the blue inhaler? Or would you give her the third one is not sure. So I'd offer her both so Laura can decide. So let's think about this. Have a look on the chat box. So some people are saying 3. Lots of people saying 3. Some say the blue one. Okay, thank you for all these answers. This is really good to get some feedback. Well done. I'll just give you another minute for you all to pop your answers on there. Well done. Oh, someone says she would know which inhaler she uses. Okay. So certainly she probably would. Most people that are asthmatic would understand which inhaler to take, but it may be that she's a little bit confused, so she's not quite sure. So both answers are actually correct, aren't they? The most important thing there would be to call for some help, really, because you're not really sure. And even though you want to know, want to know a little bit more, can she actually share that with you? And with the recent COVID-19 pandemic, with respiratory symptoms, we've got to be really careful, haven't we? So she could be asthmatic, or she could have other problems, and she could be getting an infection. So always approach with caution. Both answers are correct, but we should always keep socially distanced, shouldn't we? I know I said we were in the PE lesson, so she's probably in a little bubble with her fellow colleagues, and you may already know that she's asthmatic, but all the same, we need to be extra careful and get that help to come along. The actual, which one would we give? I think number 2 or 3 would be the correct answer to that one. So the next slide is going to be a video to show you what we should be doing.
In an asthma attack, the muscles of the air passages in the lungs are going to spasm. This makes the area narrower, making it difficult to breathe. This can be triggered by an allergy, the cold, or smoke. At other times, someone may have a sudden attack with no obvious trigger. If you think someone is having an asthma attack, there are 5 things you may see. They may have difficulty breathing or speaking. They may be wheezing. They may be coughing a lot. They may be distressed, anxious. They may have a gray-blue tinge to their lips, the earlobes, or the near base. People with asthma usually know how to deal with their own attacks by using their reliever inhaler, usually with a blue cap at the first sign of the attack. But if they don't, or if the attack is severe, you may need to help. When treating someone having an asthma attack, keep calm. Reassure them and advise them to use their reliever inhaler straight away. Advise them to use a spacer if they have one. Ask them to breathe slowly and deeply to help control their breathing. Sit them down in a comfortable position. If it doesn't get any better within a few minutes, it may be a severe attack. Get them to take 1 or 2 puffs of the inhaler every 2 minutes until they've had 10 puffs. If this is their first attack, the attack is severe, they're not getting better, they're getting worse, or they become exhausted, call 999 or 112 for emergency help. Help them to continue to use the inhaler as needed. Keep checking their breathing, pulse, and level of response. If they do become unresponsive at any time, treat a casualty who is unresponsive. So remember, reassure them. Help them to use their reliever inhaler. If the attack is severe, call 999 or 112 for emergency help and monitor their level of response. If they become unresponsive, treat as an unresponsive casualty. And that's how we help someone with an asthma attack. By going donate.
Thank you. Okay, so he's kind of reassured us that we should be using the blue inhaler for Laura. But if you're not sure, like we've said, let's ask her and see what she thinks. So let's follow her journey a little bit further and see what happens. We've thought about first aid. So Laura is reassured. She's been sat up in a supportive position. She's rapidly taking her inhaler, but she's still feeling distressed. And the teacher or the first aider decides to call 999 112. The emergency handler decides an ambulance is needed, and the ambulance is soon on its way to see her. So the emergency care assistant and the paramedic will assess Laura's vital signs. So those 6 assessments in the ambulance, and they would give her a nebulizer within the ambulance, which is the blue inhaler, salbutamol, mixed with the oxygen, and they would give that in the ambulance to see if it would make her feel better. So they would probably repeat her vital signs as well, and if they're still concerned, then they would need to take her to the nearest accident and emergency department. So on arrival, the receptionist would take her details, make sure her next of kin are informed, and she would immediately be seen by the emergency medical doctor, and observations would be repeated by the registered general nurse or the nursing associate or the healthcare assistant. And that would include the level of consciousness level, and all of those would be documented on the news chart. Now, lots of hospitals now are putting all their observations or vital signs on the computer. So that's what you would learn if you were in that area, but it's really important that we understand what's a normal level of each of these vital signs and how it can affect the patient. Next slide, please. So here are all of Laura's observations in air and in oxygen. So what I'd like you to do now is to document all of these on your news chart in your handout. So your news chart, let me find it. I've got one here, is the one that looks like this. And I want you to put the time at the top and then follow it down. So for instance, the top one is the respiratory rate. So you would put 2 o'clock, mark where it says 28 in the box. And then we're going to follow it along to the, can we see here? To the middle, and that will give us a little risk score. And then at the bottom, we're going to add them all up and see what score Laura would obtain at 2 o'clock, 2:30 and 3 o'clock. So I'm going to give you a few minutes to do that. And then if you can please pop them in the chat box, what your results would be for 2 o'clock. So for instance, 2 o'clock, if you think it was 4, put 4. If you think it was 6, put 6. So just put the numbers in. So it should be 3 numbers in your chat box. Give you a couple of minutes just to do that. And be a little bit fiddly sometimes doing that. So as soon as you feel you've got your numbers, pop them in the chat box and we can have a little look. So if we were using the correct terminology for this, we'd say that she is pyrexial. She's a little bit confused there, isn't she? Slight low blood pressure, so hypotension. She's got a little bit of a low oxygen level, so a little bit hypoxic. And she's tachypneic, which is the other terminology for a high respiratory rate. A bit hypertensive there. Hypercardiac levels are higher. Would anybody like to share what the numbers they've got?
Students, if you did want to pop it in anonymously, I know sometimes you do get a bit anxious about those things, which is absolutely fine. Yeah, we do have the Q&A box where you can pop an anonymous attendee. You don't have to write your own name in there or anything. If that does seem to be a hurdle, then yeah, don't worry, you can do it. You can do it in there. I know that's another option.
Oh, thank you, Ellie. I was not thinking of that. Give you another minute or two. So just for your information, any score above 5 would show an abnormal vital sign and would need that referral. And we can see on the chart there that at 2:30 on her news chart, she'd had her nebulizer by then. So her oxygen levels had increased. So she was less hypoxic and within a normal range, but her heart rate had increased. So she was a bit tachycardic, and that is the effect of the salbutamol, which increases your heart rate. So shall I give you the correct answers? So the correct answers at 2 o'clock would be 11. 2:30 would be 7 and 3 o'clock would be 11. So she was quite way above her number 5, wasn't she? She definitely needed to go into hospital. She definitely would be feeling pretty rough, wouldn't she, at this point? She was a little bit more alert at 2:30, probably because she'd had some oxygen. Her asthma was feeling a little bit better, and she would need a little bit more treatment once she got into hospital. Should we go on to the next slide? So let's see what's happened to her then. So she would have a few more lung function tests, actually, wouldn't she? She'd have peak flow, spirometer readings, and she may well have another nebulizer to make her breathing a little bit easier. Chances are she'd also need to have that chest x-ray, because we could be thinking, what else is happening? And remember, she was pyrexial, so that it could indicate inflammation or infection, couldn't it? So a porter would take her off to the x-ray department, where the diagnostic radiographer would would take the x-ray and inform the team that, yeah, she did have a chest infection. She'd go back to the ward area or the A&E department, and she was given antibiotics for a chest infection and steroid tablets to reduce the inflammation. She'd also meet a physiotherapist who would talk to her about breathing exercises and give her advice on how to take her inhalers correctly. Takes a little while, but Laura certainly stayed in for a few days and then started to feel a bit better, and her vital signs became within the normal range, and she was discharged home to the care of her GP, who would assess her progress. And anybody that has asthma or knows someone who has asthma would know about our asthma action plan. This is something that the person would keep, and it would be an accurate record of the medication that she's on, when her next appointment would be for follow-up, and what to do if she was feeling unwell, with all the telephone numbers that she would need to ring, so that when she needed to make sure that that was up to date, and then hopefully she would return to school about a week or so later when she was feeling better. So we've talked a lot about definitions and things, so hold it there, Alison, don't give them the answers. So what I'd like you to do is now, in your handout, is match the correct different definitions. You can just draw a line across. So let's take one from there then. So hypertension, anything with a hyper is high, isn't it? So hypertension would be high blood pressure. So pop your lines across and see if you get the right definitions on there. I get to give you a few minutes. I'm mindful of time today because it's such a busy day. So some of these the definitions, hopefully you've already jotted them down into your handout, but we will give them to you now. So pyrexial is abnormally high temperature. Next one. Tachycardia is a fast pulse rate. Hypertension is a high blood pressure. Bradycardia, low pulse rate. Hypotension, low blood pressure. Hypothermia is low temperature. Hypoxia is low blood oxygen levels. Tachypnea, which we didn't actually say on that slide, so that's a good one to investigate should you want to do any further reading, especially with the COVID at the moment. That's really important to understand about the respiratory rate. So that's a high respiratory rate. The consciousness assessment is the ACUVP. News chart is that National Early Warning Score 2. Vital signs is those 6 physiological measurements. There obviously are other measurements that we do, like glucose assessment, and ECGs. There's lots of other different measurements that we do, but these are the ones that are criteria for the National Early Warning Score. And the last one, 6 C's, the values and behaviour in practice for nurses alongside the NHS core values. So hopefully you got some of those, and if you didn't, you can complete them after today when you've got a little bit more time to reflect. We can go on to the next slide. Thank you. So thank you for joining me on this session. Hopefully you enjoyed it. Some of you may well have already got a bit of experience already, but in that case, that's fantastic. It shows you how much you know already. For other of you, some of these words may be new to you. Now, reflection is a massive part of nursing and midwifery. And if you can, reflect on this session. How did it make you feel? Did it make you remind you of something that's happened in your life previously? And then perhaps link it to an experience. So I learned this in this session and I want to learn some more. In your handout, I've given you lots of quite interesting websites to have a look at, to enjoy. And 2020 is International Nurse of the Midwife. And we know Florence Nightingale was a very special person in nursing. So there is another little question on the back of your handout. So have a little look. The answer to that is all of those. She was a very forward-thinking, wonderful nurse, and I'd really like to have her opinion of what's happening in this time, 2020, to see what she thinks. So reflection is really, really important, and it's not just about numbers, vital signs. It's about looking at the patient. Are they hot? Are they cold? Are they sweaty? What does their skin feel like? There's loads of skills that you would learn if you become a nurse midwife or nursing associate. So thank you so much for taking part. Alison and I are happy to answer any questions. So you want to pop them in there, you can speak to us if you like, or you can just pop them in the chat box.
That was amazing. Thank you so much. And I think also getting us involved in terms of, actually standing up, getting your heart rate going, I think is really nice. Students, if you do have any questions, like Val mentioned, then there's the Q&A box there. But I wonder, I have a question to get the students going, maybe for our last 5 minutes.
Okay.
In terms of those actual kind of practical experiences and things, is that what made you want to get into nursing? Was it practical personal things that happened, or did you always know or think that's maybe the route I want to go down, or go into the sector?
I think when I was about 15, I was coming home from school and somebody knocked on my door. It was my neighbour, and she'd had twins. And one of them was choking. They were only little. I can't remember how old they were now, but they were only little. And she gave me this baby in my arms and I went, oh, what do I do? I'd had no experience of first aid or anything like that. So instinctively, I kind of tipped the baby upside down and was tapping the back like you would do and shouted for me, Mum, what do I do? And it just made me want to learn a bit more, really. And then I did some voluntary work in a local hospital and I loved it, especially with the older people. They're so lovely. And then decided I trained as a nurse. And then I think that babies and maternity kind of pulled a bit, and I've been a midwife for a long time, nearly 30 years, quite a long time at the Royal Berks Hospital. And maternity is such a wonderful career as well as nursing. And it's so rewarding. It was lovely. So that's how I became a midwife and a nurse. I did a bit of resuscitation and clinical skills, and now I'm working with Alison at the Health Reach, which is great.
Amazing. I wonder if any of the students have any questions on that specifically, but it's always nice, I always think, to understand when students are at that stage making a decision, what your decision-making process is as well. Alison, was it similar for you?
I think I have a different path through the health service. So I haven't been a nurse, but I did work in a sexual health service, which is when I started working in the NHS. My career path has always been sort of guided by children and young people. So I've done my whole career has been working with children and young people. And I've had quite a big a chunk of that has been in health. So not just sexual, well, mostly sexual health, but which was absolutely brilliant and fun. But then sort of careers. And so this is a lovely sort of connection between the two parts of my career journey.
Yeah, brilliant. So we've had a couple of questions in from the students. So I'm going to start with Precious, because that was the first question. I can see them coming in now on the Q&A box. Okay. Precious, what is from Precious, what's concerning about blood pressure?
I think So blood pressure obviously is very variable to what you're doing, and you know how old you are, for instance, as well, how fit you are. So low blood pressure might make you feel quite dizzy, and it may be a bit dehydrated. So you need to drink plenty of waters and things. But I suppose more concerning is your higher blood pressure, higher than average blood pressure, because that can give you headaches and just make you not feel very well. So it's all very different, isn't it? Really, everybody's a little bit different as to what your blood pressure is, but higher blood pressure is probably more concerning and more treatable than lower blood pressure. What are the challenges you face becoming a midwife, and how would you advise us to overcome them? Ooh, becoming a midwife. It's quite emotional, isn't it, really? You're looking after two people. You're looking after the mum and the baby and the dad as well, and the family. So you have got quite a lot to think about. But then it's a very normal experience having babies, isn't it? It's not, and it can become abnormal, but for the majority of people, having a baby is completely natural, the most natural thing in the world. And I worked for a long time in the community and did lots of wonderful home births. So in my head, I'm really very in the normal aspect of midwifery. So challenges, I think I enjoyed them all, really. I worked on delivery suite for quite a long time. So actually the challenges were actually coordinating everybody, making sure everyone got the right amount of care. But yeah, it's a lovely job. So I don't think there was that many challenges that I can think of. Obviously, on a day-to-day basis, like nursing, you're doing shift work, you're doing long days, you're doing night shifts. So that can be quite tiring. So the work-life balance can be something that you need to really think about and address, you know, mentally and physically, getting enough rest, getting eating and drinking. And it is quite an emotional, it's a wonderful, seeing a newborn baby arrive is just amazing, isn't it? So I need to stop talking now and have a look, sorry.
No, that's some great questions, and that's what a good answering question there. And I'm going to ask one from Abby that just come in. This might sound ridiculous, which is absolutely no question is ridiculous, so no, but I'm slightly scared of needles. Do you think that my phobia will be massively in the way of going down the route?
Tell you a story. When I was a nurse, I went in to do my midwifery placement that we had, and the first birth I fainted.
And you're still here to tell the story.
And then I became a midwife. So I would say no. You said are slightly scared of needles. I think you have to put yourself into the professional. Why am I doing it? What is the result going to be? And how is it going to affect that person? So is she anemic or he anemic? Does he need to have iron tablets? Is that going to make him feel better? So I think after a while, anything like that, you kind of put your professional head on or your student head on, and you kind of think, actually, there's a reason for this. I'm not just stabbing them, making it hurt. You know, it's important that I know, and you learn so much in nursing that I think probably it would be fine. And you don't know till you try either, do you?
Yeah, absolutely. And that's a good thing to kind of take. That's a positive attitude to take and try it and give it a go, I think. So, and
I've had people, on work experience, faint at deliveries, you know, and it happens, and that's blood, isn't it? And that's needles. So you don't know till you try.
I think on top of that as well, it's like you're saying, you might be scared of having a needle, but you might feel differently if you were giving an injection to someone else, because as you say, there's a reason to give it to them. And as long as you haven't got to have, I mean, at some point you might have to have an injection, which you can absolutely, it's right to be scared of. But when you're giving it to someone else, you probably won't be as scared as if it was you.
No, I can see that Abby wants to be a midwife. Yay, go for it.
Oh, that's so good. And there's a couple of questions I want to tie in together. I know, conscious of time, but two really such good questions. So has your mental health been affected to some of the situations you've been in is a really important and interesting question. And then that kind of ties into Shannon's question as well, which is how do you maintain professionalism when you're in a kind of emotional situation and those difficult, challenging situations?
Oh, so mental health for myself, I presume that means affected due to some situations. I mean, majority of the time midwifery is positive, but I have looked after ladies that have lost their babies and their pregnancies had to be terminated because the babies died in utero or something's unexpectedly happened afterwards. And it's I think now people debrief amazingly, nursing and midwifery, actually, not just midwifery, nursing as well. We do seem to have better support networks for staff than when I trained many years ago. It's important to talk about it, I think, and not to feel silly, not to, oh, I should be able to cope with this type of thing. So you do have to be really aware of your mental health, your physical health, when you're in a caring profession, no matter what it is, I think, really.
No, absolutely, and that plays into the professionalism element, I guess, from Shannon, which is, you know, approaching it in that way and responding to it afterwards.
Yeah, Royal College of Midwives and Royal College of Nursing have got loads of information on their websites, and they're like caring for the carers, and as well as health, you know, healthcare assistants and maternity care assistants. Everybody within the team should be caring for everybody, and that's the one thing in nursing and midwifery. You're not really alone. You are within the team. As long as you communicate within that team, I think that's best to do, really.
Absolutely.
Someone said, would you recommend watching videos on childbirth? I've never watched, not Call the Midwife, what's the other one? The one where actually filming One Boy Every Minute. Yeah, I've never watched that. I couldn't watch it. Because you're completely separate from the emotional connection. So you could watch it and go, yuck, or you could watch it and think, you know, it's okay. So I don't know about that, really. I haven't, because I've been midwifery for a long time. Call the Midwife I used to like, actually, because that's so fun, isn't it? It's just silly. But yeah, I mean, you can do just to get a little bit of information about it, I suppose, but not something that I would do.
Well, with one final question, just conscious of time, and I know that everyone needs to go and grab some food and some water and have a stretch, but Katie's asked a couple of times, so I want to get to that question. Could I do both children and adult nursing? Do you have to specifically choose one pathway and just do those, or can you do a bit of both?
I think you have to do separate, don't you? I know certainly at Reading, in the accident and emergency department, for instance, there is a separate children's clinics there. And some of the children's nurses were then doing like some courses to help them work within the adult courses. But I think it's separate.
Yeah, no, that's great. And we can also, you know, we have a Q&A panel later with various nurses, someone representing children's and someone representing adults. So Katie, hold that question as well and ask them, because I think that's a great question. Lots of them coming in. So happy with how engaged everyone is in the session. Thank you so much, Val and Alison, for the session. It's been so brilliant. But
can I have one more question? Can I answer one more question?
Of course,
someone said on there, I did notice it earlier, what could noting down the wrong results accidentally affect the patient? I think that's what it means. Does that mean, Serena? It's really important that you get your observations correct, and that is what you learn either as a healthcare assistant or the registered nurse, midwife, whatever. So you will learn how to do it, and you will learn how to count a pulse rate for a minute. Really make sure you know what you're doing. Yeah, so I mean, if you did put down the results wrong, you've still got a patient in front of you, and if their results are really wrong and they're ill, they're going to collapse, and then you're going to have to deal with it. So observations are really put there to stop the patient deteriorating. So you want to stop that happening. So if you do the observations and they're wrong, that patient will still deteriorate. So you've still got to deal with it at the end of it. So you will learn how to do it right, and you'll know the consequences if you don't do it right as well. So yeah, you would learn that.
Yeah, no, that's a great question as well in terms of the skills and things people take away. So Serena's just thanked you there for the response, so that's great. Yeah, but well done everyone. So many good questions. Any of them we haven't had a chance to get to, hold them. We will have a chance in the rest of the day. Thank you so much for our panelists and running that session. I loved it, and I think that was really good, you know, getting everyone involved. So well, everyone has a chance to grab some lunch, have a little bit of a break, anything. I'm going to hang around for a few minutes now just in case anyone has any questions, practicalities, logistics, any of those things. But it's been so great, so thanks a lot for your time.
Cool.
So great, and yeah, thank yous coming in through the chat box now, so that's good to see. Obviously happy students. Thank you all, and yeah, let me know if you need anything. I'll be here.
What time's the next session, Ellie?
The next session will be at 1:30, and all of you will have the link in your agenda notes So that will be another kind of breakout session at 1:30.
Okay.
Thanks a lot.
Well, there's
See you then.
some other questions in there as well, isn't there?
We can always type the answers now if we want to. I just want to
Shall I
allow
type
those
them
students.
in?
Yes, yeah. If why not? Those people that have just asked those last questions, hang around and see the answers. But everyone else, if you need to, go and grab yourself some lunch or a drink or anything.
Can I answer them on there actually?
Yeah.
How do I do that?
So,
Oh, maybe not.
on the Q&A box, can you see the Q&A?
Yeah. Oh, we've got lots on there. Have you enjoyed your nursing career? Ooh, I can't. It's not letting me type on there actually. Answered. What does that mean? Don't know.
If you want, I can run through them maybe, and then we could just quickly run through those questions if anyone does want to stay on and listen to those answers.
Yeah, can do.
So up to you really. Let's just cover two. Let's do the last two that came in. So Liber, what qualities make a good midwife?
Oh, midwife. Oh, I think you have to be understanding, non-judgmental. That was really important because that's, I think, came up before. Because you meet all sorts of people in all sorts of walks of life, as you would do for nursing anyway, but certainly for midwifery, people with all, people that are not caring for children, that may have domestic abuse, that may, affect that growing child's development. So definitely non-judgmental, kind, considerate. That's the same really, I think, as nursing. They're very similar for the qualities. You have to be quite organized actually, quite pretty multitask, I would say. Because you're not only looking after the mum, you're looking after the baby, and you're thinking, is she progressing normally? But as a midwife, you learn what normal is. So, and then you've got your parameters outside that normal when you ask to get medical obstetric advice. So, yeah, quality is very similar, I would say.
Amazing. No, that's great. And Liber, I hope you've got noted those down. And then I think a nice one to end in is Molly, just one from Molly. So have you enjoyed your nursing career? A nice way to end before lunch.
Definitely. Golly, I started at 18 and I only retired clinically last year. So I won't even tell you how long that is. It's a long time. And I still miss it in a way. As much as I love this job in Health Reach, I still miss that NHS a little bit as well. I think with COVID as well, where, that's massive, isn't it? In the last year, that's changed lots of people's thoughts on the NHS, because it's not really had a very good press over the years, has it? The NHS, everybody's always slagging it off. Whereas now I think people are really understanding what nurses, midwives, doctors, all of the healthcare professionals do, and really are appreciating them. So yes, I have enjoyed it. I've been very lucky. I've had a great career.
Amazing. And what a lovely kind of note to kind of finish this section of the day on. I love the fact also that I can see in the chat box that the students have learned from the last sessions and they're answering each other's questions. So someone asked around the different routes in, and Nadja, the fact that you could answer that now means that we're doing our job and you're getting an off from today. So well done, and we'll see all of you at 1:30. Any questions, then you know that you can contact us via email or those numbers that have been texting you the updates today. So that's where we are. Have a lovely lunch and I'll see you back then. So thank you both.
Thank you.
Bye.